hallelujah. Mama, bima, muka cross border. I go good for my better, no good for my better. Now what's up on the time? I was to work on the eye. Many, yeah, cause some money I find. Yeah, welcome back to the Human Narrative. This is your host, Dorinda. It is a pleasure to be back, and today I just wanted to play a little bit of Julian De Lo and Bo Alvin. This kind of focuses on mental health, but this is a different type of conversation around mental health that I wanted to speak on, right? This is one that I've been wanting to talk about for a while now. And I think a conversation that I had this weekend also kind of triggered this topic for me to say, okay, maybe it is time to talk a little bit around this topic because, our mental health is important, right? And we have to be able to take care of that. But before we even get into all of that conversation, Final Four is going on. And of course, the Gators. No, you know. No, you know. Now the Gators are playing the Florida Gators are playing the Houston Cougars tomorrow. Okay, say whatever you have to say with my pronouns, but yes, we are playing them tomorrow. But now I am both a Gators or a Gator because I represent Gators Nation, but I am also the Houston Cougars, right? Because I live in Texas, so I have to be able to represent both. So don't hate on me if I want to be able to share my heart to both team. Okay, so that's where I stand. But at the end of the day, I'm repping my Gators, but I'm also supporting my Houston Cougars because I'm all about love. All right. So tune in tomorrow and watch the game. It's going to be hot. Hot. We'll see who wins. But like I said, welcome to the Human Narratives. And today's topic, I really would like to focus on something that has been on my mind for a while that I wanted to have a conversation around. And I believe a conversation that I held or had yesterday kind of triggered me actually saying, okay, let's go into it. Let's go into this topic, right? So the perception of mental illness in African culture. Oh my goodness, in African cultures. I mean, the perception of mental illness in many African cultures is deeply, of course, influenced by, traditional beliefs, spirituality, and also a lot of, you know, um, tribal beliefs or values and perspectives as well, right? I'm a born African, so I understand this experience. I have lived this experience. So I know what this conversation evolves or can be about when, it's brought to the table, to kind of explore it. So, it can be very complex, of course, but, traditional beliefs, may come from, communities. And in most communities, in African communities, or some, right? Because things are changing. But in some communities, mental illness is not seen as a medical or psychological issues at all. It's not seen as that, but maybe they may relate it to spiritual causes. Someone is possessed by a demon or some kind of uh demonic or voodoo or some kind of displeasure, right? Or a witchcraft or curses and things like that. Or maybe because they, there's this assumption that, oh, you did something that you weren't supposed to do, and as a result, this is a punishment for your wrongdoing. Or even for broken some form of social norms or taboo, right? So there are traditional explanations that may come from, one, going through some mental health illnesses or mental health crisis, but they may not, those symptoms may not be associated to a mental health or medical concern because, of that type of explanations or belief system, right? So people may go to like traditional healers or spiritual leaders, or sometimes even faith-based figures, instead of the doctors or even therapists. But there is also stigma and shame around, mental illness in the African cultures, right? When someone is suffering from mental illness, a lot of times they may not even speak about it, especially the older generations. Younger generations are starting to be, well, they're bold. They're not even starting, they're bolder, and they're speaking up about how they're feeling. And we're seeing even more men who are stepping up and saying, hey, I am feeling depressed. I am feeling anxious. I am not myself. I'm not okay. And that is amazing, because when you're not okay, you're not okay. And there shouldn't be any taboo around someone not being okay. And it should not be questioned as if you are being interrogated on an episode of Law and Order. This is not something that, is that's a joke. I'm laughing because that's how, painful it is when you have to hear those type of stories. So but there's this stigma around, and shame around, mental illness as well, and is labeled, where someone may be labeled as they're mad or they're crazy. When I was a child, I saw a lot of mentally ill people on the street in Africa. And I actually thought that these people were mad and crazy. And I actually thought that these people did something in which maybe karma came back and hit them and it caused them to go crazy. These were my beliefs because of the way I was brought up in the environment and the community and the belief system that I was around. So I believe these things as well as a child. So, and these people are socially isolated. They are, so, I mean, if you imagine resources being so limited for people who don't have or and are trying to thrive, imagine those who are socially isolated or cast as crazy or mad and who don't have any resources to support, right? They don't even have a community. So they're just seen as a waste on the street. So there's this stigma and this shame. And a lot of times families don't even want to associate themselves, with people that they know that their family that are struggling, because they may assume that, what if someone assumed that, okay, well, if this is a curse on this family, well, I don't want to have to mess with them. So there's this denied opportunities, for education work, and even the opportunities to even, try to build and bounce back up if they've already labeled you as taboo, then are going to be considered taboo. So the stigma can delay or even block access to a lot of, different resources, services, opportunities, in, in an individual, a person's life. Community and family influences, play a huge role as well. Mental illness or mental health is not always, an individual issue, but it does affect the entire community. And, if one person is not helped, it affects the system, the system as a whole, right? So we have this urban and rural divide. Of course, in the rural area there are less resources. In the urban area, resources are much more available. But even in those two different communities, in those two areas, mental illness and the resources are really limited as well. Although, yes, like I said, there's more awareness of people, younger generations speaking, the older generations are still dealing with mental illnesses, and they are not receiving treatment. A lot of times people are just saying, I'm just gonna pray over it, and that's it. And prayer is beautiful, don't get me wrong, I love the Lord. There are also things that he has provided for us here on earth for us to be able to utilize, so we can take care of ourselves, so we can live the purposeful life that we are intended, that he has desired for us to live, right? So what are some of the changes? So emerging changes, the NGOs, of course, there are NGOs, and I'll go a little bit more into that a little bit later, and public health campaigns that are, of course, increasing or helping, education, or to reduce these type of stigma, but to increase education for people to be aware, and also social media that, around discussion around, how, to be able to encourage this type of conversation openly without, being stigmatized, or being feeling like you're labeled, or being feeling like you are wrong for feeling, something that you yourself may not understand, right? So what is the prevalence or statistics related to mental health in African countries? Um, According to the World Health Organization, about 1 in 4 people in Africa will experience a mental or neurological disorder at some point in their lives, right? I've had instances where, friends, family have said, hey, we need, these type of medications, of course, things over the counter that you can send because it's so expensive back home, and all of those type of things, right? But just imagine things that you have to prescribe for, like diabetes, or schizophrenia, or bipolar, things like that, people that don't even get diagnosed for back in most countries, in those African countries, so they're not being treated for any of those type of disorders, right? Depression, anxiety. Of course, like I said, there is awareness, and that is helping a lot, and that is growing, because of these organizations, and because of, social media, because of young people, who are, advocating out there and putting the word. But like I was saying, the World Health Organization basically stated that 1 in 4 people in Africa will experience a mental or neurological disorder at some point in their lives. And this is going to affect over 30 millions of people. For example, depression. Depression affects over 30 millions of people across the continent. Anxiety. There's a lot of issues that causes people to be anxious. Lack of employment. Your rent is due, and you have no, job or income coming in, and you have children, and you have family to take care of, and you also have to make sure that they are, they have nutrition or food on their table, all of those type of things, poverty, conflicts, displacement, things that will lead to some form of neurological defect when one is not having the basic needs that they need on a day-to-day basis to be able to function and make logical or rational decisions. psychosis, those type of things, like I said, schizophrenia, all of those things are things that are becoming a global concern. And there's a lot of treatment gaps. Substance use disorder, substance use disorder, a huge problem, right? Increasing especially amongst youth. So, talking about the treatment gaps, right? I mean, 85 to 95% of people with mental disorder in Africa receive no treatment at all. No treatment. I mean, there are no people are not most people are not even diagnosed. So if you're not diagnosed, you don't know what you have. Then of course you don't know what you're treating. So a lot of times people are turning to substances, right, to self-medicate, and those type of things like that. So this is extremely due to one, their lack of mental health professionals, um, no psychiatrists, fewer than maybe one psychiatrist per 100,000 people in most countries. I mean, that's a shortage even in the United States. We went through a pandemic here, and we went through that concern where we realize how the importance of our medical staff and our health professionals and what they bring to the table. It was we had to realize that during a pandemic as people, not when things are great. I think it would be so beautiful when we recognize more when things are great, but we recognize that we are valuable and more, worthy during those moments, right? So, so there are less psychiatrists, there are less mental health professionals, nurses, social workers, whoop, whoop. I love my social workers. I love you with my two weird fingers. I love you. Gotta go call my nail ladies and lady get my nail done. All of those things. But yo, I gotta do my little self care, boo. So we have mental health. In on an average, there are people who don't even consider part of self care as part of because they don't have the resources to even for food, for example, to be able to consider any of those type of other things, right? Yes. So this is really a crisis, um hot topic that is a concern. There's a lot of mental health concerns in a lot of regions that are in Africa right now, a lot of countries in Africa right now. For example, the conflict and displacement in South Sudan, in Somalia, and in the DR Congo, post traumatic stress disorder concerns for a lot of refugee populations, youth unemployment and violence are increasing, like in Nigeria, South Africa, and in Sierra Leone, where I was born and where I was raised for till I was like about 9 or 10 when I left. And in Kenya, has led to increased depression, suicide, drug use. I hear stories all the time about youths using these drugs that are changing their cognitive awareness, and engaging in extreme and violent crimes. But a lot of these youths were also used for civil wars, as child rebels and child soldiers to kill, and they were given all type of substances. So the mental health concern is not just now, it started in so many other situations. And and still there are no answers around, besides the awareness that's increasing, some of maybe the resources that are starting to become available. But that stigma and that lack of awareness is still continuing to be huge as well. Mental illness is heavily stigmatized, seen as a spiritual problem, curse, and moral weakness rather than a mental um, a medical condition. People with mental illnesses may be hidden by families out of shame. They may be labeled, like I said earlier, as mad or dangerous, out of shame, because they also do not want to be subjected to those stigmas, right? Because they have to eat, they have to feed their other kids and their other family. It is not right, but they do have to survive. Lack of mental health professional, as I mentioned earlier, as well, limited infrastructure and services. They're underfunded. Facilities that do exist may be underfunded or outdated. In those major cities. I mean, not even including the rural communities or populations that are underserved. Those communities a lot of times don't even get any of the resources. They normally will um, turn to tribal medicines through like leaves and things like that to kind of help a family member, or go to like a medical a voodoo doctor or somebody like that to kind of help them take care of their family or things like that. But a lot of times in those temporary fixes, it doesn't work. It makes things worse, right? Especially if you are dealing with a condition such as schizophrenia or bipolar, where someone may need to be medicated and also continue to be seen by a professional for care. Uh, Financial barriers, right? Healthcare is not covered. A lot of times there's no health insurance, right? So you have to pay out of pocket. Well, maybe in some African countries there are health insurance now, but not to my awareness. But a lot of things are paid out of pocket, which makes it impossible for a lot of people who are living in poverty. And the governments don't have no money, resources, really huge allocated funds set aside for healthcare budget. A lot of those budgets are not used for healthcare or even for the civilians, but they are used for lavishly livings, and lifestyles and all those type of things. So those are the consequences. The people don't get the resources, but the people who do have the funds and the resources to make it available for the people who need it are lavishly enjoying those resources. So reliance on traditional healers, right? Like I mentioned, because there are no resources, or faith or churches, right? So a lot of times it delay or prevent access to professional care, lack of awareness and educations. Sometimes now, I have to also get on the people. Sometimes the resources are there, but the lack of education, the lack of awareness and stubbornness, and um, just stubbornness and wanting to stick to traditional belief, no support or help is ever received, or when it's available and when it's open and willing to be provided. So the lack of mental health literacy can also cause the symptoms to be misunderstood, or as laziness, or someone who's being possessed, or just bad behavior. A lot of African mentalities that you have to thrive and be strong and do this and do that, and if you are not doing those things, who you don't you are being lazy. And I think, like I said, awareness and education is being more, those perspectives are being more, are increasing now, which is great, but that is reality as well, of what I'm speaking of. and around. There are also weak policy and political will. Many African countries do not have national mental health policies. They do not implement them. There's not conversation around that. Mental health is low on the list, is not a priority. It's not compared to like a lot of the infectious diseases like HIV, malaria, or even TB, right? And even some of those areas, there's not a lot of fund around those areas as well. Even when it's infectious, a lot of those funds are coming a lot of times from international places, and those funds are not even invested in the departments and places that it should be invested in. So there are still issues in those areas. So the role of traditional belief and healers in African in the perspective around mental illness and mental health is significant and is rooted in the cultural and spiritual practices, right? That is where a lot of times people will go to first, a spiritual leader, before they will consider anything else, or a church, or a traditional leader, right, of contact. And some of the spiritual mental health, spiritual leaders or supernatural lenses that can be perceived as, a punishment, a witchcraft, and all of those things, like I mentioned earlier. But there are people who can also guide you in the right place, right? It's not always negative. There are people who are trusted leaders in the communities that who people go to for guides and counseling and spiritual protections, and those people can also create some kind of remedies to help that person feel better, because maybe these are some of the remedies that have been used from generations to generations to help those type of symptoms or conditions in the past, right? So there are experts, leaders that don't have anything that has to do with voodoo, witchcraft, any of things like that. That are also very beneficial, and that also trusted. Then most of the formal healthcare system, that the communities will prefer going to these leaders instead of the formal healthcare system, because they are more about the people, whereas the formal health system will be more about the money, and the people don't have the money, and the formal health systems staff also are not getting paid. So it's a survival system, and it's sometimes very hard to kind of maneuver anything at all to go through. So let's see. Of course, there's a lot of barriers and delays that may impact as a result of the lack of awareness. Um, I mean, the way we move forward, is that we have to respect cultural beliefs while also ensuring patient safety, right? Is very important. Culture is important. Respecting those cultural beliefs are very important, but we have to collaborate. This is not about fighting. This is not a war. This is not about conflict. We have to collaborate so that we can understand what traditional and modern mental health system is, both in our continent, and so that we can increase awareness in both generations and generations to come, so that we can improve the way we can improve the way we look at mental illnesses. We can improve the way we look at the conditions, the diagnosis, the treatments, the outcomes, and how we also perceive it, right? And how we provide support around it, because that's very important. How we provide support around it. So I hope that this information, helps a lot. when it comes to our conversation around how mental illness is viewed in African communities and in cultures, it is often viewed as if this is, something that is a sin or it's a taboo, or that this person, is ill, and not in a cognizant way in which they need the support to be able to be stable, but in a negative light. And it's really important to understand that mental illness is real. When someone is depressed, they are real. When they have anxiety, they are real. When they have schizophrenia, they are real. When they have bipolar, they are real. So if there are concerns about those things, that's why we take those individuals to a mental health professional that will evaluate those symptoms and provide a formal diagnose about what is going on with that individual, so that there can be a collaboration around supporting that person in being able to receive the treatments that they need, the support that they need, so that they can excel into the human, the person that they're deemed to be in this world, right? But if we don't open or create that safe space for someone to understand that this is normal conversation that we should have, and that this is a topic that it shouldn't be perceived as a taboo, and where they can feel safe and come openly, if we don't create those safe spaces, then we continue to have generations of mentally ill people. And we wonder why trauma continues to be generations after generation. The cycle is not broken, or is not being broken, because we're not increasing awareness, because we're not talking about it, because we are not developing solutions, and also we're not providing support, right? So we need to be able to change our perspectives so that we can have understanding for change to happen. So it has been a pleasure to be back, and just being able to throw, some of these information out, so that we all can be aware and woke about what we need to be aware and woke on, so that there are change for all people, for all people. Much love and respect. This is the Human Narratives. Your girl, Dorinda. God bless.